Hi, and welcome to another episode of Physiology is pH Fun, a web series by myself, Catherine Sokoloff, and Elizabeth Westwood, where we explore such topics in our bodies about proteins, cell membranes, and homeostasis. And funny enough, homeostasis in our body is commonly regulated by our acidity levels, or pH.
Hi, I'm Elizabeth, and today's pH Fun topic is inflammatory bowel disease, more specifically Crohn's, which I have. I was diagnosed at the age of 21, and I happened to be a smoker of 5 years before that, which are both things that contributed to my prognosis. There are also other risk factors that can contribute as well.
Crohn's is characterized by inflammation in our digestive system, from our mouths all the way to our rectums. It's most commonly, though, seen in our bowels or small and large intestines. Here you can see a normal versus a Crohn's intestinal wall. In the normal, you can see the segmentation as well as the passageway is much larger. In Crohn's, you can see redness and swelling, which contributes to stricturing of our bowel walls, causing a smaller passageway for food and other nutrients to be absorbed into our system.
This is a picture of the small intestine, just in a more enhanced view. In the small intestine, there are these things called villi, which kind of look like finger-like structures. Why these are in the small intestine is because most of the absorption of water and nutrients is done in this area. So by having the villi, it increases the surface area, allowing for more absorption to happen. And specifically on the villi and the cell membrane, there are protein channels that the nutrients go through to be absorbed. What this is showing us is the lumen of the small intestine, which you can see in the top left corner, which also is showing our normal microflora and our own antigens, which help aid in our digestion. Next is the columnar epithelial layer, which is where everything becomes absorbed through. And this structure is very good inside the small intestines because it's able to regenerate a lot faster. And next we have the muscle layer, and finally in the bottom right-hand corner is our blood supply, which is in the villi, which have red blood cells and white cells. Another important concept is homeostasis in this normal working small intestine. What normally happens is if there's a foreign antigen or foreign bacteria in the body and it comes inside that extra tissue layer, inflammatory process will start by the T cells attacking that foreign antigen, and then which causes an inflammation process. But in someone who has Crohn's, this is actually where homeostasis goes wrong.
With someone with Crohn's, such as Elizabeth, there is no known cause or no cure to the disease. However, there is a gene known as the CARD15 gene that in 25 to 35% of Crohn's cases has been mutated, where a protein, NOD2, has been known to show in our T cells and other white blood cells that help attack our own immune system. On the cellular level of how Crohn's works, we can look at the layer of the intestinal wall again. First of all, in the epithelial columnar layer, there is a loss of integrity where researchers think that the adhesion molecule, which is a protein attached to the cell membrane, has lost some of its abilities and causes the layer to be more leaky, therefore letting in some of our normal microflora or other bacteria that's normally there in our lumen of the intestine. Then what happens is our T cells or other white blood cells attack this antigen thinking it's a foreign antigen. It attaches to a protein receptor on the T cell wall, and the T cell releases cytokines or chemokines. A common cytokine is the tumor necrosis factor, which then goes out and signals other white blood cells to enter the area, causing an immune response in the wall of our intestines. This is what contributes to Elizabeth's common symptoms of Crohn's, such as lower abdominal pain, diarrhea, or other abdominal-related symptoms.
Since there is no cure, we can use medications like immunosuppressants, anti-inflammatories, or other medications like those to help reduce the symptoms that someone with Crohn's may experience. And also, there are some surgical procedures that may be done if there's an obstruction in the intestine. To conclude this episode, Crohn's causes inflammation in our bowels. It disrupts the normal inflammatory response, which contributes to homeostasis in our digestive system. We've also discussed how our other key concepts of proteins and cell membranes contribute to the pathophysiology of Crohn's.
And even though Crohn's is a chronic illness, Elizabeth has been able to control her symptoms through the use of diet, exercise, and medication, and has been living a very healthy lifestyle since her diagnosis. Thanks for watching another episode of Physiology is PH Fun. Next week we're going to talk about coronary artery disease.